city vehicles?
Just police.
Just police? No fire vehicles or no general vehicles?
I don't think any of their vehicles fit through the car wash, but no, I don't think
They
so.
have the Jeep or the Liberty, whatever.
No, just police.
Chief Skibasi.
Okay,
Just police.
thank you.
Okay. All right. I have a motion by Mr.
Molnar, Brandon.
I mean,
No,
Ms.
Ms.
Molnar,
Molnar.
supported by Ms. Frangiana
Mr.
to
yeah.
approve. All those in favor say yes.
Yes.
All opposed say no. Motion carries. Next tonight is motion to approve contract renewal with Blue Care Network for the period of 7/1/2013 through 6/30/2014.
Motion to approve.
Support?
Motion to approve by Ms. Brandana, supported by Mr. Solers, I believe that was. Any discussion? Hearing none, all those in favor say yes.
Yes.
All those opposed say no. Motion carries. Next tonight, motion to approve contract renewal with Health Alliance Plan for the period of 7/1/2013 through 6/30/2014.
Move to approve.
Support.
Motion to approve by Mr. Stapleton, supported by Ms. Fitzpatrick. Any discussion?
Madam Chair.
Mayor
I
Lambert?
just want to clarify too, because I think the question was asked, but these are now aligning with the fiscal year, and they haven't previously, right? So not just aligning or the new contracts with the rates, but the fact that they're 7/1 through 6/30, they align with the fiscal year and enables us to better handle budgets so we don't have carryover change in rates in the middle of the year. And
Or budget amendments?
right.
Okay. All right. We have a motion by Mr. Stapleton, supported by Ms. Fitzpatrick to approve. All those in favor say yes.
Yes.
All those opposed say no. Motion carries. Next tonight, a motion to approve contract renewal with Blue Cross Blue Shield of Michigan for the period of 7/1/2013 through 6/30/2014.
Motion to approve.
Support?
Motion by Ms. Brandana, supported by Mr. Solers to approve. Any discussion?
Madam Chair,
Ms.
I-
Molnar?
I probably should have asked last time, but I'd like to ask, can't think of her name, Human Resource, Sheila?
Ms. Gorski
Gorski.
Schulte?
Schulte, Gorski, all of them,
Schulte.
okay, Sam, can I ask the Human Resource Director, is that how you say it? My question is that with the rate of HAP increasing, I'm presuming they're still lower than Blue Cross, but at the rate they're increasing, have we considered another option maybe for the future? If they continue to increase at that rate and with the Blue Cross not increasing, it's like a 6 or 6.5% difference, I believe you said, in the increase difference?
HAP is 9.5%.
Yes, and Blue Cross is 3 or 3.5?
3.5%.
So is that something we're looking into? Okay.
I mean, one of the things that we need to do through our healthcare cost containment committee is to, once we get a handle on kind of where HAP is going, and I think we know where it's gone the past 2 years, it's been a 9.5 increase. We need to start looking at other options and offering to the collective bargaining groups. You know, there's ways to lower those rates. I mean, if they're willing to take on a $20 copay for an office visit, that could reduce their premium substantially. Actually, Blue Care Network has pretty much been flat and has been one of the affordable coverages, and that may be something that we want to start offering to our employees.
Okay.
Blue Cross itself, you know, we've been fortunate. We had pretty much 2 years where it was almost flat, and now we've had a 3.5 increase. So, I mean, there are options out there, and it's what we're trying to do through the Healthcare Cost Containment Committee is to sit down and present those options on a quarterly basis, and we will continue to do that, and where we can get agreement and where we can get interest in doing that, with the cost share between the employer and the employee now, it serves us all well to look for the coverage. The other thing that we can do is we can look at utilization reports, and we've done that with our HRA, and we can see who's, you know, at what percentage we're utilizing that high deductible. And you can do the same thing with emergency care visits, office care visits, urgent care visits, annual exams. I mean, you can pretty much drill down the percent of the people within a healthcare suffix that are utilizing those services. And some of the services cost more to utilize than others. Another factor is if a contract has certain riders that have to be in the policy, based on the collective bargaining agreement. You know, an in vitro rider is very expensive. So, you know, as we negotiate contracts, as we sit down with the union presidents during the Healthcare Cost Containment Committee, we've had some discussions about, you know, HAP not being the most economical like it was maybe 5 years ago. So we'll continue to have those conversations.
Could add, Madam Chair, what they, what we've continued negotiating, and the hard part, even with the HRA, and as much as the HRA has benefited us, what people don't realize is we've got so many people out there, retirees, that are locked into specific coverage that doesn't exist anymore, and that's typical part of negotiation and practice. It's just the old way of when everybody started going from traditional plans to PPOs. Well, all of our contracts, really for the most part, lock, people into those traditional type plans that healthcare providers don't provide. So they're cutting out a specific grouping for us to continue to provide a specific plan that they don't offer anybody, but they have to carve it out, and that they charge more for us to be able to offer that. So, and that's a hard part, from sitting down with the bargaining groups to negotiate changes in retiree coverage, even though, again, whether it's changing coverage, changing the way it's offered versus, the coverage, and not taking away coverage, but changing the way it's offered, and educating, and Ms. Gorski-Schulte and her staff have done an excellent job of making the transition to HRA with all of the retirees and making the opportunities available, because those are always, big questions. And my membership was always, we went from a basic traditional to PPO, and it was like you pulled the rug out from under everybody, like, I'm not going to be able to go to my doctor anymore. And so, there's the challenges that you have to deal with and manage, 400 employees, 400 retirees, and the different options. And as is stated, and I think the councilwoman asked a good question from the idea that you can't really have contracts with names of providers in them. And we kind of got stuck with, optical dental providers and specific to providers, which then kind of gives them the upper hand because they don't have to negotiate in the market. So we aren't out there, we can't actively go out and seek bids to change the way they, price providing us per se, because we still have to provide those specific coverages for those specific groups. And that hinders the ability to really get your best pricing out there. So, but again, as we've, finished 7 of the 9 contracts, the 2 that are outstanding, if we, the Healthcare Cost Containment Committee is something that exists. If we can get that language in there and continue to meet with the, full groups, and those would be things that, the idea that you'd bring those forward to the group, let them take them back to memberships so you can educate and make transitions which benefit both, cost savings from the city standpoint and employees, as Ms. Gorski-Schulte stated.
Thank you. I didn't mean to get that complicated about it.
Okay, so I have a motion by Ms. Brandana, supported by Mr. Solers, to approve. All those in favor say yes.
Yes.
All those opposed say no. Motion carries. Next tonight, motion to receive and file the paid invoices for May 2013.
Move to approve.
Support. I have a motion by Mr. Stapleton to approve, supported by Ms. Fitzpatrick. Any discussion? Hearing none, all those in favor say yes.
Yes.
All those opposed say no. Motion carries. Next tonight, motion to receive and file the budget performances report for May 2013.
Motion to receive and file.
Support.
I'm sorry, yeah, that's right. Okay, and I have a motion by Ms. Brandana to receive and file, supported by Ms. Fitzpatrick. Any discussion? Hearing none, all those in favor say yes.
Yes.
All those opposed say no. Motion carries. Next tonight is a motion to approve Plant Moran to provide audit services for the fiscal year and June 30th, 2013, for an amount not to exceed $144,500, funded by various funds and component units.
Motion to approve.
Support.
Motion to approve by Mr. Solers, supported by Ms. Brandana. Any discussion? Hearing none, all those in favor say yes.
Yes.
All those opposed say no. Motion carries. Next tonight, motion to approve payment to Western Wayne County Fire Department mutual aid for an amount not to exceed $20,000, funded by general fund.
Motion to approve.
Support.
Motion to approve by Mr. Solers, support by Ms. Brandana. Any discussion?
Madam Chair,
Mr. Sellers?
If just somebody could explain this, I think this definitely needs some thorough explanation.
I get started and
Mayor Lambert?
Mr. Reynolds can fill in any blanks. This is, we, as members of Western Wayne, we are responsible by our interlocal agreement by population to provide certain number. For us, it's 4, for 2 teams, so 2 members to each team. USAR, and the hazmat teams. With transitions, if you recall, I think last year we paid a similar because with the layoffs, there wasn't replacement of those people on the teams with the staffing. And then with the recall, one of the members didn't come back and that person wasn't replacing the team. And this is our requirement by the interlocal agreement that we have to pay our fine to supplement their coverage, I guess, of the rest of the communities in this. So, as Mr. Reynolds, and if there's any blanks there you want to fill in, feel free. Stated, I mean, our membership, I guess, as we discussed last night's study session, is just under review as to, weighing the benefits with what we have to incur, given that we're one of, I think, 2 communities that are paying members of both the DMA and the Downriver Mutual Aid and Western Wayne. I think it's us and Romulus. The Airport Authority, so.
Okay. All right. All right, I have a motion by Mr. Sellers, supported by Ms. Brandana to approve. All those in favor say yes.
Yes.
All those opposed say no. Motion carries. Next tonight, motion to receive, this is a motion to approve appointment